Hi, I'm Dominik Havsteen-Franklin. I'm a consultant in arts therapies and a researcher. And today I'm going to talk a bit about the digital developments in arts therapies and the populations that we serve, particularly those who are clinically severely vulnerable, and how, particularly in the COVID context, we managed to meet their needs within a very short period of time, given the limitations on social contact. I'm going to start by just comparing the COVID crisis and what we anticipate to happen in terms of our understanding of disasters. So this comes from a community trauma response model that was developed by the Centre for Disease and Control Prevention. What's very evident is that in the pre-disaster there is a sense of threat, whilst there is the emergence of the disease or disaster, in this case the pandemic, we see that there is a real galvanization of resources and people functioning extremely well together to meet the demands, the new risk. So this brings with it a sense of profound cohesion, and we remember the Thursday evening clapping in the UK for the nurses and the NHS, and the really heroic work they were doing. As time went on, there were various different fractures and struggles and divisions within society and politics, and cultural difficulties that led to a sense of disillusionment. Who can we trust? What's reliable? What ground do we have to stand on as a community? I want to talk a bit about the kind of emotional landscape, because really crises, one of the key components of a crisis is the sudden change in the ways that people interact. And so we can even begin to define a crisis or a disaster as something where the quality of communication changes and the ways that people interact. So this was a study looking at measuring emotions within social media. What was very relevant from all the excerpts, I think there were about 5,000 excerpts from social media on the 7th of April, was that terms that express worry and anxiety were very high. Sadness, relaxation, fear, anger, happiness, and so forth were very small in comparison with worry and anxiety. Now, there's some argument that perhaps worry and fear are quite closely related and connected, but nonetheless, we can see that this disturbance causes this response to threat, which is initially individual and social anxiety. This is further confirmed by mentalhealth.org's investigation, where anxious and worried again came up very high. What, in a positive sense, what can happen with anxiety and worry is that we have a sense of empathy. We can begin to share this concern together, but also get a sense of what it's like for the people around us. This is something that happens when we have anxiety and worry. We're concerned for our neighbour. What can happen is that accompanied with hopelessness and isolation, there's a sense of there is no solution. We're heading down a dead end. I'm on my own, and there's no way out. There's nothing I can do. Eventually leading to often severe depression and anxiety that needs some extra help and resource and support to help that person. Worry can also lead to a concern, as we've talked about before, about your neighbour, and how you begin to get a better appraisal of the situation, which can inform a solution, which you can reflect upon and think about what you do next. And so this becomes a much more constructive use worry and anxiety. But all of this is highly influenced, and we have lots of evidence for this now. It's highly influenced by the way the media describes the situation, but equally the quality of our social contact with friends, family, neighbours would also influence how we use and manage our worry and anxiety. We may have some vulnerabilities, such as mental health issues or physical problems, which again would impact on our own sense of worry for our personal safety, but also social safety. And of course, the socioeconomic and the cultural values make a huge difference in terms of the role we feel we can have in mobilizing change and how a threat we feel. So something interesting here is we talked a bit about mental health, the mental health population, and in this survey, which is a government survey, about 4,000 people currently in treatment are, as a result of COVID, are clearly getting a lot worse. So nearly 50% said they're getting slightly worse as a result of COVID, but a staggering 20% are getting much worse. So this is also an opportunity for us to rethink how we work as a society and how we look after the most vulnerable. So crisis really shines a spotlight on the fractures, the problems, the vulnerabilities and the struggles that we face as a society. This is an ongoing struggle for the government, and we know that there are many people who simply, as I said, don't access services, who don't, and that's not to do with them. That's to do with how those services are organised around them. So, in order to increase the reach of mental health interventions, NHS should accelerate its plans to roll out evidence-informed psychotherapeutic digital mental health interventions, ensuring that these interventions reach people in socioeconomically and/or culturally disadvantaged groups. The majority of people's needs, mental health needs, aren't met, and there isn't one size will fit all. We really need to think about how we develop new interventions which may well overlap, and we expect them to, if they're to have some kind of evidence base. But we need to be thinking outside of the box about how we meet the whole society rather than just a good portion of it. Now, of course, there are a whole range of factors, right from the person saying, "Yes, I have a problem," to finding an intervention which feels right, is acceptable to them, and I'm really talking about culturally acceptable as much as personally, and something that is evidence based, or at the very minimum evidence informed. And in today's world, we really have to think about different forms of digital intervention as being a way of reaching so many people that simply are not in touch with mental health services in an effective way at the moment. As a consultant for arts therapies in CNWL, NHS Foundation Trust, I was tasked with developing a protocol for how we change from face-to-face arts therapy, sitting in a room with somebody, how we safely transition to digital art therapies. Our main aim initially was to provide a kind of support for those people, something to hold them, to prevent any worsening of their condition, and to prevent further crisis. In America, there's been quite a lot of work with veterans, and so we did look to some of that work. Within 3 weeks, we produced a survey asking people how people were finding it, the transition, and actually we were very pleased to see that the majority of people found it manageable or quite easy. We were looking at nearly sort of 72% of people. The minority of people found it quite difficult or very difficult, and And this was to be expected given the rapid use of a medium which was not traditionally used with this group of clinicians. But we must also remember these are kind of creative art therapists, and there is some versatility and adaptation. That's kind of a lot of what the arts are about. They're about reflecting, understanding, being creative, thinking outside the box. So for this group, 300 or so patients that are being seen in community services, most of them were being seen by clinicians within weeks. And was through painting, music, role, storytelling even. And this really helped to help people to feel confident again about their role in society. Listening, validating, mirroring, engaging, helping a person to be grounded, being quite descriptive about what's happening. Really trying to convey the narrative, letting them know it's been heard. Obviously very arts focused. We considered changes to their environment, and we really consider this to be strength based and recovery focused. So really helping them to establish their own sense of agency and autonomy in conditions where they felt like it was slipping away. So we found that 96% of respondents had transferred treatment to online individual sessions. 81.5% of respondents said they felt that Tele-arts psychotherapies were having a sustainable impact on preventing crisis and deterioration. Pleased with this feedback, that there was confidence in a process that was new to all of the arts therapists that we were working with. This was one of many different initiatives happening where arts rose to the surface and to challenge very quickly. As I said, was something that seemed acceptable to many. If you want to look further into this, the WHO recently did a synthesis of evidence and came up with a number of different areas within which the arts impact on prevention and promotion of health as a form of treatment. And you'll see right at the top there, social cohesion and addressing social inequalities. The arts as a whole, when they're facilitated in a way that focuses on these kinds of issues, can have a profound impact. Right from mother and infant bonding, speech and language, educational, caregiving, prevention of ill health, mental illness. This is something that is being taken up on a global level. And I say again, I think this is because this is becoming increasingly acceptable, but perhaps most importantly, we are finding new ground of helping to make success acceptable through digitalization, through social media, through video platforms. And so this spectrum of more trauma-focused interventions, there's something which is much more supportive, I think, is finding its place on a much wider scale now. And this partly is due to the COVID-19 as a global crisis, not only highlighting the gaps in provision, but also challenging us to find new ways of meeting people. From Professor Anne Lafferty at the Royal College of Nursing, where she said that the arts help us face the huge uncertainties we are confronting. The arts are a route to building a sense of resilience, a sense of solidarity, and a sense of strength. And I see the use of the digitalization or the use of video platforms, for example, as one way of extending outwards in ways that we could never do before. Thank you.